Good morning, everyone. Happy to be on the last day of the Bergen Exchanges. We all made it till the end. Thanks for joining us this morning. We're going to be presenting the whole day except the last panel. We're going to be talking about a project, Child's Rights. It's an honor for me to be here. I'm very thankful to Marit, Siri, Zacky for all the organization, Lara too. And on this project, today in this panel, we're going to be talking about a survey that was conducted for 41 countries, OECD countries, about attitude and adherence to child's rights across the world. So for this panel, we're going to have three of the members of the project. We're going to have Marit Skivenes. She's professor at the Department of Government, the director of the Center for Research on Discretion and Paternalism of the University of Bergen. Marit heads the research, the Commission for the Official Norwegian Report on Improved Quality and Legal Protection in Child Protection from 21 to 23. She's a very recognized and leading expert on the field of child protection system with numerous publications in well-regarded journals, and she's also a very popular lecturer and widely used expert by the media. We also have Mathea Loen. She's a PhD student now at the Center for Research on Discretion and Paternalism and the Department of Government, and she holds a master in comparative politics. And her research interests include human rights, social norms, network, public opinion, public discourse, specifically in relation to children's rights, protection, and family values in Europe. And then we have Zacky Pratama. He's a pre-doctoral fellow at the center, and he holds a master's degree in business analytics from the Norwegian Business School. So we welcome them to the floor. So while they are sitting, Marit, she's going to introduce the study and the overreaching objective with the population studies of the OECD countries with child protection systems. Mathea will talk about confidence in child protection system and relation to the trust, institutional trust. And Zacky on the reunification in care order cases, right? Okay, it's a pleasure. So each of you gonna have, let's say, 8 to 10 minutes. Is that okay? Yes? Okay.
Okay, and then we will have 15 minutes in the end for questions.
For questions,
so.
yeah.
Okay, we will do our best. Thank you so much. So wonderful introduction. Thank you, Andrea. And wonderful to see you all here. And also, I think we have some online, so it's great that they are attending as well. Yes, so we are going to talk about population studies, and we have done studies in 41 countries, which is all the OECD countries, and that is one of the first studies ever done on this topic. So it's also groundbreaking in that sense. The part of the project that we have undertaken this study is in relation to an interdisciplinary project, which is led by political scientists, by legal scholars, and people that have a training in social work. And this is because child protection, children, is kind of a very kind of multidisciplinary research area, or should be a multidisciplinary research area. So, but I will just quickly turn into the topic today. Why population studies? We know very little about what people think about child rights, what they think about child protection, what they think about the government's responsibility when it comes to children that are at risk of harm and are at risk of abuse. So that is one reason for doing it. Of course, populations are the citizens, and they are electing their politicians. So that is also important to know something about what do they actually think about these topics. And then again, do they have any kind of relationship with the type of welfare state you have and the attitudes that people have? So are they influenced by, for example, the child protection system that they have in a country, or the type of welfare state that they have in a country? So just quickly going to show you the map of the OECD countries. So you can see that it's kind of quite a wide range of countries. Then when I talk about child protection system, together with Jill Berwick and Neil Gilbert, both at UC Berkeley, we have made a topology on different types of child protection systems. So I'm going to show you just a kind of an illustration of this, and it's just going to be very superficial, but the main point is that countries will have a different orientation to what type of risk they will tackle or focus on. So in some countries, you will have very, very few kind of risks towards children that you will focus on. You will primarily focus on exploitation. And then you will have in some countries, you will have a type of system in which you focus on deprivation. And then you will have systems that we are more familiar with in Europe and in the American countries, and that is the maltreatment risks. And then you will have systems that focus more on well-being, and then you can understand that we are also turning more towards needs and what children kind of need in addition to being protected. And then finally, we'll have countries that have a right-oriented child protection system. And some of our kind of basis in our project is to test out this typology, and one part of it would then be the population studies in this approach. And then I'm just going finally to show you the OECD countries in which they are categorized in according to these systems. And here we can see that we have some of them in yellow that are right-oriented, and then we see that some of them in light green are well-being oriented, and then you can see the two other colors as well. So by this, I will have a handover to Mathea. So we are going to give you just a tiny kind of taste, so a little tasting, a small tasting menu, where we will focus on confidence, and we will focus on obesity, and we will focus on some key principles in child protection when it comes to reunification if there has been a care order of a child. Yes. So.
Yes, thank you. So thank you, Andrea and Marit and Zacky and all of you all for being here early on the Friday, the last day of Bergen Exchanges. I'm going to talk a little bit about how we're working on the issues of trust and public support for child protection systems. So what I'm talking about here today is more focused on the performance and sort of output side of the system, and not necessarily the value-based or normative support, but that is also something that we are interested in, and I think Zacky and Marit will go more into detail on that. So as I start here, to set the scene, child protection systems are coercive, whilst also having as their primary goal to protect children. And they do so by intervening in the private sphere, in the family, and they have the power to limit and restrict the child, the parent, and the family's freedom. And the decisions that they make and the questions they evaluate are inherently normative. They have to consider questions such as what is a good life, what is a good childhood, what is the best interest of the family and the child, most importantly. And because these interventions directly affect the lives of children and families, the legitimacy of child protection institutions rests heavily on public confidence. And there is a large knowledge gap in trust in child protection, and we want to find out more about both the origins, the characteristics, and the both long-term and short-term consequences of trust and mistrust. There are a handful of studies, but not that much to build on. Okay, so trust is difficult. You know, for people to trust others and for others to be trustworthy, we need to have some experience or some knowledge about the others, whether a person or institutions, past behavior, and their previously stated intentions. Because the foundation of trust is the calculation about the probability that the other person or institution's behavior coincide with what they said that they would do, right? So if previous experiences are bad, we will have low trust. But if previous experiences are lacking, how then do we decide whether we should trust someone or not? So a very clever thing that not I, but someone else came up with is this idea of trust heuristics, which is a theoretical perspective that argues that people do not necessarily distinguish between trust in different political institutions. Basically, we take what we know about one institution and sort of apply it to others. Typically one that is prominent in the media, like a prime minister or outspoken politician, or something like that, and then we use that to make up our mind about what we think of the government or the parliament. And as far as I know, this has been done a lot on input institutions, political input institutions, but not on this to the same extent on output institutions. So that's what we're trying to do here, to see whether on the output side of politics, but also on the inside, whether we can sort of see overlap in child protection trust with other institutions. So yeah, I'm going to skip some parts because this is taking longer than I expected. So yeah, we have this survey. We fielded 3 trust batteries, and I will just show you a couple of graphs to show some results.
Should you say a little bit about input and output side, just for what is meant by it?
Okay, yeah. So the input side of politics are basically the institutions where politics is created. It's the formulation of policies, whether we decide what kind of political goals, political objectives we want in a country, and this is typically the government or the parliament, political parties. And then the output side are the institutions that actually implement and put into action these policies. So it's the bureaucracy, the case, all the welfare institutions, teachers at school, etc. Okay. Yeah. So just as a very sort of quick overview, this is a trust index on. It's very small, actually. I'm sorry about that. But here are some countries that might be interesting to take a look at. So this is an index where we've asked about trust in child protection agencies, workers, and judges. And the correlation between these 3 individual indicators are strongly correlated, which already suggests that there is some sort of overlap between trust in different sort of entities already within the child protection system. And yeah, I've just highlighted some countries that could be sort of interesting for the audience to see. We have with the highest among the ones with highest trust, Norway and other Nordic countries, and then the US. I don't know, surprising or not surprising, at the lower end of the scale. Okay, so this is just the trust in child protection variables, but then I want to also show when we look at trust in child protection together with trust in the other input and output institutions. So on the left-hand side, this graph is also not sort of, there's something about the colors here, so I'm sorry about that. So yeah, trust in child protection is strongly correlated with trust in input institutions. So what we have here is questions on trust in the government, local government, bureaucrats, parliament, parties, and politicians. And then an even stronger correlation exists, and we see that from both the steepness of the correlation slope, and also the sort of how the countries are clustered more together towards this line between child protection and output institutions, so police, courts, bureaucracy, as I mentioned. Finally, this graph here shows these different system orientations that Marit introduced, where we have the rights-oriented system, the well-being-oriented, maltreatment and deprivation-oriented systems. Again, average scores of trust in child protection. And, I mean, so there's clearly some sort of correlation between the institutional context and citizens' attitudes. And just to round off with a couple of questions. So based on what I've shown you now, when it comes to measuring trust, Is it necessary to measure every single indicator, every single small entity, or is simply one overarching trust question enough? That is sort of something that we will ponder on whilst we are writing this paper. And if not, how should we approach the measure of trust, specifically in institutions such as the child protection system, that to many is unknown, but also to many is sort of captured by a negative or critical discourse in the media, which may or may not reflect an accurate picture of what is going on. Yeah, and in terms of building or enhancing trust across these institutional sort of systems, which we know are rigid and slow to change, is there a way to improve trust in the countries where there is a larger group of people who don't trust the child protection without larger reforms or changes in the legislation and laws that guide child protection? Okay, thank you.
Okay, okay, thank you. Super interesting, and I have to say that this is a very nice finding. So that will give, but it doesn't always turn out like that. So no, so that is promising. So thank you so much. I'm going on to a different topic, more empirically, more kind of issue-oriented. So, is obesity a government responsibility? We know that there's a big issue now about obesity, and it's a pandemic almost, they say. So, but is it a government responsibility? Should the welfare state restrict people's freedom to secure them a better health? And should the government make interventions in the family if a child is obese? So these are some of the questions that could potentially, one, it is about the government responsibility, and kind of how much we will allow the government to do. But also it is about which type or kind of sector of the welfare state. If it's kind of a health issue, if it's a social service issue, if it is a child protection issue. And could you then also put force behind it and go against the parental authority, for example? So this is some of the questions that we are kind of studying in this project. And of course, you will all think now immediately, well, risk matters. So it depends on obesity and obesity. So what do we actually mean by that? And it's a very difficult kind of discussion, of course. What is obesity? But we do have some kind of classical definition. I will not go into it, but I will just show you a couple of examples on this. So you can think that an adult person is considered to be obese if he is 175 centimeters and he weighs 92 kilos or more. Okay? And then if you go to a child, you will see that a 7-year-old girl, 120 centimeters, is considered obese if she weighs 28 kilos or more. Okay, so I'm aware that we are kind of moving into a territory where you kind of would discuss this and what do you mean by that and how much kind of how healthy, unhealthy is it. But if you look at the policies and how kind of the medical profession looks at obesity or kind of for social sciences or from the policy perspectives, there are huge disadvantages and problems with obesity. And that's also probably why it is a big issue. For a child, there will be huge impacts on the child's childhood, which has impact on the educational dimension, on the social, having friends, being able to do what you want to do with your life, etc., as a child. Then, for this child being obese, becoming an adult, there are also a range of documented problems and challenges, which is also detrimental to the life of that person. And finally, from the society, there are, of course, a lot of challenges, and many of them are economic, but there are also impact on our health system, and there's also about kind of how we should spend our resources, etc., etc. We had a dinner yesterday with some participants from the workshop. We exactly discussed then how they now have to rebuild hospitals because both the health personnel and the patients are getting heavier and heavier. So you need bigger doors, you need kind of bigger kind of beds, and you need kind of more and more equipment and to be able to actually to tackle the patients. So that is just kind of one example. Okay, so this is some of the backdrop, and then the question that we have asked is, and then you can also consider this one, is the child. And this is a 7-year-old girl, and she is growing increasingly obese. Her teacher has kind of made remarks about this and tried to encourage the family to do some changes. Nothing has changed. The question is then for you, yes or no? Should the state do anything here? Should they have any type of intervention? Then we will have a little bit more risk, because now she has high blood pressure and breathing problems. Does this call for a government intervention? And finally, the parents are not particularly positive to this encouragement. Yeah? And what we know from other research on, for example, on families, is that when the parents or the family are very negative, that also can potentially pose a risk for a child. Okay, so that is the question. And I'm assuming that you all have made up some conclusions here. So let me just first now look, should the government do anything? And what we do see is that the majority support a government response. And we see that increased risk results in increased support for government response. Okay? This is kind of all the data just put together. So about 30% for the low risk, 18% of the high risk would say no government intervention. And then a large majority on the other end. Okay? Country differences. We have 41 countries. And here we see it, and I'm not able at all to see what's on that screen, but we see on the blue, dark blue, that's low risk, on the green in the middle, high risk, and on the light green, very high risk. And I've just, as Mathea did, I've pointed out some countries, and here we can see that we have, on the top, it's Colombia, and then, help me here, and then it's Norway, and in the bottom is the US. And these are showing those that would agree to an intervention, okay? And then if we look at the high risk, and you can probably also find your country here if you have, we can see that we have the same here, US again low, Norway in the middle, and then Colombia, and then we don't have very much difference to the very high risk. We can discuss why that's so. Okay, so these are very interesting, and I'm kind of also a little bit surprised that we have so many supporting that we should have government intervention on this issue, because it is a very difficult, and it's been discussed in the literature, that this is not necessarily a straightforward question. Then we can ask, should it be a health, should it be a social services, or should it be the child protection system? And what we do see is that most see it as a health issue, naturally I think, but also some see it as a social services, 10%, and then 20% do see it as a child protection issue. If the risk increases, we see that more would say that it is a child protection issue. Okay, so that you would be willing then to potentially use more force or intrusive interventions. Could give some perspectives of, do you think about this as a poverty issue? Is it a social economic class issue? And I think that the social service indicates that not many see it as a class social economic challenge. Okay, I will round up. I think that we can have some policy indications of this. What we do see is that there are a broad public support, and as I said, it's a bit surprising actually, because there's been struggles around it. We do also see that it's a call for health interventions, which is kind of where they want the government to be, and that is a type of intervention that is less intrusive based on the voluntary aspects of it. And we do also see that increased risk also is correlated with being willing to use the child protection system. And if we think that the child protection system have the means to then be more inclusive, then it's also a higher accept for that. So, so that is the obesity approach, and I will hand it over to you, Zacky.
Yeah.
Yeah.
Yes. Thank you. Just check. Yeah.
There.
Okay. Yes. So thank you, Marit and Mathea as well. I would like now to present to you the other aspect that we in this 41 country that we're currently studying, in which we are talking about restrictive freedom, and to be specific, in the case of family reunifications. So this is a study that we're currently writing as a paper as well. We are basing on the idea of this parents patriae doctrine, in which government are responsible to protect the vulnerable people from harm. This includes children as well. But then, in child protection context, the matter of like protecting children is quite delicate, as in like there's need to balance this other principles, such as the parental rights and their autonomy, child rights, and also their self-determinations, and also, again, the state's responsibility to protect and preventing harm. And therefore, like when we are thinking of removing a child from parental care, this is the application of the doctrine, but this is also an impure paternalism that is implemented for the children as well. So, yes. So when we're talking about care orders and reunifications, the court has this guiding principle that care orders are just a temporary measure, and the final or the ultimate aim is to reunify the families. So the reunified child and the parents again. However, there are some circumstances of why court might not decide to reunify these families, whether it is related to the child, that it could harm or break the established relationship with their foster families, or also thinking that there's a possibility that reunification may harm child's development as well. Or maybe it's just because of their biological parents are considered as still behaving negatively towards the child and considered unfit for the child in the current state. So this sort of like reasoning comes from the case of Loen and others versus Norway. So this case, the child was taken by the court, and then the parents tried to, the mother tried to receive back the children, but then like the Norway still said that it is not allowed. The ruling was still the child should be separated by the children, by the parents, right? This is until the decisions at the level of the European Court of Human Rights at the Grand Chamber, where they decided that Norway has actually violated the Article 8 of the European Convention of Human Rights. And this sort of like case derives a lot of like decisions or like makes us like thinking as well in the academy. It's like, again, simple questions or like repeating questions, I guess, in this political science. Like, should government intervene in this private sphere? And then where do we draw, where is the threshold for the government to decide whether they should reunify or not reunify the children, right, with the parents? And if this is or the courts that's saying this, what about the populations? And that is why we are trying to discover this in this 41 country research. Yeah. So I think this is also a little bit extension to what Marit has said before, like why do we do population studies to understand the society and also the policies and also their the dimensions of politicians and everything that's related to our life. But also that in the current literature, it's not much of studies that use population as some sort of like a measure or like a data to understand this phenomenon, right? And then also this is a larger part of the project that we're doing. So aside from population studies, we'll try to study about the judges and the courts and all the constitution, and to understand whether all these 41 countries, or at least the countries that we are having right now, have the same sort of like conclusions across these aspects of or of the sort of like individuals or actors in the system. And the reason that we say that like why understanding family reunification is crucial is that this is also a part of like understanding government threshold of intervention and also legitimacy, as like Mathea said, and then to understand what is family in these days, because maybe back then family are just nuclear family of like father, mother, and child, but then with the change of age, the structure of family might not be the same, right? So it's not only biological family, but also sort of like chosen family. Yeah. Yes, and then also OECD countries, because like most of the policies are quite similar to each other, right? So this is what we asked to our respondents in the survey. We have these 4 statements. 3 of our statement based on the interpretations of the Norwegian courts. That's the statement 1, 2, 3, 4. So 1, 2, 3. Sorry. So parents unfit as a reason, and then also harming the child's health, and also the significant time has passed. And then we add one more to understand this family stability that can be caused, can be sort of like ruined because of the reunifications. So we did this, and we asked our respondents in 41 countries. And as we see in the statement of parents unfit, harm health, and also the harm stability, we had sort of like overwhelming majority of respondents saying they agree of government intervention. On the other hand, if you look at the statement number 3 on the time has passed, the sort of like the divisions on the answers and response are quite, it's not that balanced, but then it's quite not, it's not one-sided. So therefore, in this paper, we kind of like want to understand why is that. But before that, like I will showcase you, these are the country mean of each statements. So for, in the harm health statement, we have the least amount of variance. Meanwhile, the time pass has the highest variance, as the result shows earlier. And we have several countries over here. I need to remember what it is. I believe it is, because I couldn't see. Spain. Oh, sorry. I believe it's Spain, Mexico, and Sweden. Yes, thank you. And Chile, I believe. Yes. So these 4 countries are the countries that we found out to be like, they're very consistent in saying that they are agreeing with these government interventions. Yeah. So we try to look at this a little bit on the time pass statement using regression analysis with these sort of independent variables, and we found out that individuals that have a high basic value on security support the non-reunification, and then high authoritarian values as well. high confidence in this child protection system, and also populations from the child rights country, so that's the Nordics countries mostly, have sort of like tendency to go for to prefer the non-reunification intervention by the government. But what's interesting for us is that individuals who said that they are more oriented towards parents' right actually supports this restriction more than the individuals that prefer or like oriented towards the child rights. So that is something that we also highlight in our paper, that it's quite fascinating for us, because usually it should be the other way around, right? So that is definitely something from this. And of course, from our research, we could think of, yes, in general, people have high acceptance of the government interventions, as we previously seen on Marit's presentation on obesity. So we had the same sort of like conditions or like situations as well in terms of the reunified families. And then these results actually align with this with the parents' patriarchy doctrine that I mentioned earlier, in which the people also believe that government should protect, or like should protect the people, the vulnerable people, right? But then, like, this population views actually contrast what the judges or the courts believe in terms of like having this guiding principle of aiming for reunifications. So that is, I believe, that is from us actually. That is that. Yes.
Okay, since Hege couldn't join us, I don't know if you wanna have 5 minutes to wrap up. We still are very good with time.
Yeah, we are very good with time.
Yes,
I'm
that's
surprised,
why.
but let's just open up.
Okay.
Yeah. I think we're just going to pick up on the last one first. So thank you for that, Jeff, and Mathea will help me here as well. But so this is a study that we did in 23, and we have some of the countries in 24.
Yeah.
So that's when we did it. When it comes specifically, when it comes to these indexes, yes, we have kind of, and we also use them to develop the typology. So I would like to add to that afterwards on. And we have also this prosperity, and we have kind of tried to gather it. It is kind of they give some results, but it's also challenges, because it's difficult to measure these things, and then you have patchy. But absolutely, we are aware of it, and we put it into that. So thank you for that. When it comes to Israel, we have, and here is where I need some help from you, if you are able to remember this, because we had. How did we do that? It was only the state of Israel. How was it? This kind of
Well, the
focus.
survey was
Yeah.
in Hebrew, so it was only recruiting respondents. But obviously, that's the respondents and who participated in the survey, which doesn't. I mean, that doesn't. When we talk about child protection in Israel, that sort of covers non-Hebrew speaking as well. But of course, this sample is only based on populations. That's the
Okay.
Hebrew-speaking population.
Okay. I was just also thinking of the location, but that we wasn't kind of any geographical.
So this is obviously there was stuff going on at the moment of the survey. So I think we actually need to take another look at sort of the areas, because I think it might have been limited in the geographical area as well, because of course the occupation, the war.
Good. So and thank you so much for questions. So Dorothea, excellent with education, and I think that is also a very good point going into kind of how to measure government intervention. And we had kind of these three: health, and then we had social services and child protection. And I also need to underscore this is like an explorative study, so we don't have much as also Zacky underscored, not much to stand on here. So absolutely we should have thought more of how to define these interventions measure. And it could be that you will see that if you have a program at school, that could be seen as an intervention. I haven't thought about it like that, but that doesn't exclude that others could have thought about it when they are responding. So that's a very, very good point. So thank you for that. And when it comes, Francesca, absolutely, and I think that I'm glad you're saying that you're not surprised, and I need to hear more about that from you, why you're not more surprised. When it comes to the food industry, absolutely, but we haven't included that, no. So I think that the closest we came was to think about that it is someone else's than an individual problem, is to the social services approach in a way, which is very indirect. So there are some huge measure discussions there, and I think that is also very important when we talk about the whole class thing, and so as I mentioned, yeah. So that is just very valid points, and also you point to that we need to do some further steps and new studies on this topic. I think then we're also relating to what you asked about, Anne, when it comes to the food industry and thinking about class and so on. So that's point well taken as well. When it comes to the child protection system, that is and here Jill, feel free to chime in. So this is, we have made a topology based on 50 country studies. So that means that part of this project is to tease out what are the characteristics that is able to to count for all of the countries in a way, or make it more empirically relevant. But when it comes to welfare, it's more the orientation of the system, that what it would make an intervention to. So you know that, for example, for the US, you will have a very high threshold for an intervention. You will only think about very high risk and danger to the health and life of the child, versus if you have a welfare-oriented system, you also think about the needs of the child. So you have different orienting principles in a way of how to approach a family and a child at risk. And when it comes to the right-oriented, we have put that on as then you actually adhere to the CRC, or the Convention on the Rights of the Child, in a much stronger way, and especially on the participation rights, and seeing the child as an individual right bearer, and not only a part of the family, but also as an individual right bearer. And in child protection, if you don't see the child as an individual, then it's very difficult to put the child in the child protection decision-making process.
Okay, so if I understand the last question correctly, or at least one of them, so we haven't asked specifically about trust in.
If someone knows that better than you.
No, we have questions about trust in experts and researchers. So maybe that could be a proxy if you decide to look into that. Of course. The correlation between these variables that I showed is, if it had been perfect correlation, I would have been amazed. There's always variation. But it is interesting to think about these countries that either cluster at the above the slope line and below, because it would indicate that, especially in the context of input, they trust the politicians more than they trust the child protection system, which would be unexpected based on what we know. We know that in terms of welfare services, the trust is typically higher than in the input institutions. What would explain that someone would have very low trust in child protection but still high trust in other institutions in general? Poor experiences is the umbrella term that I will use to say something about that. But I think that there's more that we can think about in terms of explaining these countries that are further away from these regression, the regression line. Yes, and also spillover effects, it's the same thing. Like, it's harder to maybe measure or estimate models, but it will be possible to dive deeper into that. And I think something that I did for one of the papers in my PhD was to sort of use different types of trust to predict an outcome, and then using interactions, you can sort of see the effects of different marginal effects. Yeah. Okay.
Okay,
Yeah.
thank you, and lovely, Katra, to dive into the typology. So so we've had 50 kind of country case studies, so which has been provided with experts in these 50 countries, and different countries across the globe. And then we have developed a typology, and then what we're doing now in this project is that we're actually then trying to test it empirically, and by that we also will then when you ask about is there any feedback to it or something, that will be kind of one of the feedbacks, and trying then to find kind of how to understand it better. So yeah, so that's a good input, and we will work on that. Toba, yes, I think you are very correct, and I saw that Francesca was nodding, and so I think that there is of course some structural elements here which is very, very kind of prevalent, and it's very difficult. And I also read the paper that you have advised me to read about kind of how that this actually we are changing, our bodies are changing due to hormones and due to other kind of industrial kind of poisoning, etc. Makes it kind of very difficult for an individual, in addition then to the big companies kind of constantly prepping us with non-healthy food. So I am kind of, and I think it's also interesting to visit the thought. Is it structural violence, or kind of how to kind of to think about it and twist it around a bit. So yeah, so thank you for that. I just wanted finally, I see that the time is going, and Andrea, you're not going to cut us short, but I just wanted to draw attention to Zacky's kind of presentation also, because these principles that he is looking at has also been what the Norwegian Supreme Court has said, or at least 3 of them said, that these could be the reasons, as they interpret the European Court of Human Rights, for not reunifying, and therefore also potentially then terminating parental rights. And then some of the discussions within the legal community have been, do you need to have all 3 of them in place, or is it sufficient with one? And my understanding is that this is an ongoing discussion, and so that is it. But I think it's very interesting then to notice that you have such a high degree, as we are talking about 92 to 95% support for those 3 kind of principles, except for time, and I think that's also primarily explained by time is a very evasive concept. This time. Well, I will be a little bit light. I will be very kind of, you have all these things. Yes, well, I just wanted to comment for that. Yes, Andrea, thank you so much.
Okay, thank you very much. We are done with the first panel on this topic, so we're gonna have a short break, 15 minutes, and then we go back.